This episode of the ZuLoo Pōōdcast is sponsored by ZuLoo Inc., a benefit corporation dedicated to the goal of universal access to toilets, hygiene, clean water and sanitation through the power of social enterprise. Learn more at ZuLoo.com.
Would you wipe your bum with toilet paper imprinted with your favorite superhero?
I mean, initially that sounds a little disrespectful, but maybe it's like, it's such an intimate thing that you're like, this is how close, this is how much you mean to me that I trust you to take care of this very important task.
So that's a yes for you.
I don't know. I'm not a superhero.
Welcome to the ZuLoo Pōōdcast, where we talk all things poop, toilets, and sanitation. Through insightful news, impact stories, and quirky humor, we aim to discuss and highlight the critical role toilets play in whisking poop out of our lives, the impact toilets have, or lack thereof, in the health and wellness of humanity, and what ZuLoo is doing to help solve the current global sanitation crisis.
Hey, ZuLoo crew. We are so excited to have you back for another episode. Another really great lineup today. We sat down with Angela Huston and Ruchika Shiva. They were both coming to us from different parts of the planet, which was really fun. And they both work with IRC, who's doing some incredible things. Their reach is pretty global. Their influence is very widespread, and they've been around a really long time. It was fun to get into the history of their organization and hear what they're doing now and what some of their future projects are. It was
change makers.
Change makers.
Where were they coming from?
International think tank actively building strong water, sanitation, and hygiene systems from the bottom up.
Yeah, they're a really full scope, holistic organization. And Angela was somewhere in northern Italy.
Nice. Okay.
Ruchika was in Delhi. She's the country coordinator for India. So bless her heart, it was nighttime and she wasn't feeling well, and she still joined us, which was really, really
Somehow
nice.
we got all the time zones to kind of
line up. Yeah, she was
we got
amazing.
we got the Zoom to work. Thankfully,
Yeah.
It's like okay, yeah. So we're excited that they came on the show.
Yeah, it was a really great interview. But Darren has a surprise for us today. We haven't done a snap poll in a long time, and Suzanne is here. This is her first one.
Yeah, I'm ready for this.
Okay.
No turning back.
And this is kind of an easy snap poll, kind of a yes or no,
Oh.
And if you want to elaborate, you can.
Okay.
But
I'd love to elaborate.
If you, what's your favorite, superhero?
You're asking the wrong
like
girl.
DC,
I am not part of the Marvel universe.
like Marvel, DC Comics, I
would have to say mine is Marvel.
You could say Wonder Woman default, right?
Yeah.
who
she
doesn't like
was
Wonder
awesome. Yeah.
Okay, Wonder Woman.
Okay, I vote Wonder Woman.
Wonder Woman.
Captain Marvel.
Captain Marvel. Okay.
I don't even know who that is. Is that not Captain America?
No.
Oh,
she's a female.
Oh, is that the one who, is that Brie Larson?
Yeah.
Oh, she's awesome. I like her.
Oh, that's right. They went to female Captain Marvel, right?
Hooray
Captain
for
America.
Chick superheroes. Yeah.
I hope I'm getting that right. I'm like, I know she has more power than Superman.
What? More power than Superman?
Yeah.
Well, I think it's a different genre, right? Because
Yeah,
Superman's
I
like
know.
Another universe.
Yeah,
like
he's a
DC
different universe, but
and Marvel is another universe.
Right.
Yeah, this is a world I can't swim in. I don't know these waters.
You don't have boys, do you?
No.
See, this is what I don't have boys either, but I've kind of learned a little bit through my nephews.
But in our universe, would you wipe your bum with toilet paper imprinted with your favorite superhero?
I mean, initially that sounds a little disrespectful, but maybe it's like, it's such an intimate thing that you're like, this is how close, this is how much you mean to me that I trust you to take care of this very important task.
So that's a yes for you.
I don't know. I'm not going to make superhero.
She was stretching out. She was like, well, it's this intimate relationship.
It is an intimate relationship.
I think it'd be funny.
Yeah. I think I'll stick to the
who gives a crap.
Yeah, the who gives a crap prints.
Yeah.
I think
for those of us,
I'll stick to animal prints, polka dots
to the toilet paper.
I don't know that I want
That's
my
right.
superhero space.
This is pretty creative stuff. But anyway, but yeah, Marvel, they just announced that, and they did this like 20 or 30 years ago, but they came out with a roll of toilet paper that was They took the entire comic book
Oh.
and they printed it on a toilet roll. And so basically you kind of read the comic
Oh, wow.
as you're unrolling.
Okay,
And then, of course, you dispose of it.
They're just encouraging men to spend more and more time.
I know, right? But they are encouraging reading. So
Yeah,
Yeah.
that's true.
Yeah,
that's
it
true.
is. If you don't get a chance to read, at least this is an opportunity.
Yeah.
Probably better than sitting there with your phone, right?
You know what? I bet
You got some toilet paper.
that could be a really effective tool in potty training. So
You could put all kinds, like the alphabet,
yeah,
read your scriptures.
I think this is just this is a
Probably
burgeoning
that'd probably
market.
be sacrilegious.
yeah, I think
Yeah.
that's a little.
Don't do that.
Yeah, don't do that.
Depends how liberal you are. Yeah. Anyway, so that's
so they
happening.
really did do that, and they did that like 30 years
Yeah. So
ago.
anyway,
It
they
was
just announced the re-release.
Oh,
You can
okay.
actually go and you can't get it on the marketplace. Maybe in the future, but apparently you have to download the Marvel app and you have to kind of,
Oh, that's too complicated.
you got
Too
to
many
get
steps.
it through there.
Not worth it.
So I guess it's for your diehard fan. You got to.
Mhm.
Anyway, it's a thing, right? So those of you out there who are into superheroes,
diehard fans of
Yeah.
wiping
I always
yourself with your favorite.
Your favorite face.
when I was a kid, it was the Flash. The Flash.
Yeah, I
Oh,
remember the
Flash.
Flash.
The guy with the little lightning bolt.
Mhm.
And he was blonde, right?
I think so.
Yeah.
Yeah, because I was
And there
super.
was
him.
Shazam. I always thought Shazam was a girl, but it's a guy. Apparently, Shazam is a guy.
Oh, I thought Shazam was new.
Shazam's
Yeah,
has been
Shazam
around
was-
for a long time.
Oh,
Shazam.
I know
They
nothing.
recently had a movie that came out with Shazam, but Shazam has been out for a while.
Yeah.
Or my name is Suzanne. Sometimes I got called Shazam.
Shazam.
So that's why.
I can see that. I can
That's
call
a
you
great
Shazam.
nickname. Yeah,
Yeah.
from now on.
Shazam.
Welcome back, Shazam.
Yeah.
This is Shazam. But yeah, I like the Flash because he was fast and because I was slow as a kid. Like everybody's like, "Come on, Darren, you're in the bathroom for an hour. You're so slow. You're so slow." I'm like, I think I like the Flash because he's like, he's in a bathroom. Okay. Also, snap poll. How would you feel about? And this is kind of political, maybe, but it's. Well, this is in the news, right? There was a man who was kicked out of the soccer stadium, the FC Portsmouth soccer stadium, because he went into the ladies' toilets, claiming he was transgender, but didn't really exhibit any sort of like transgender traits, I would suppose, right? It wasn't like he was just going in because he wanted.
It seemed
to,
a convenient excuse, maybe.
And so
I'm sure it wasn't because the line was longer, because that's never the case.
that wouldn't be the
Right?
case.
Yeah, that's right.
There's always more people in line.
Yeah. So anyway,
female
I guess
toilets.
he just sort of claimed it like, oh, well, that's why I went in here because, he thought that would be defensible. And I guess they weren't buying it. Right. Maybe so. Snap poll. How would you feel if men came into the women's restroom on purpose? Would that be a no-no? Or are you just like, oh, whatever, we're all human?
No, I think I'd be pretty uncomfortable with it. Which is why I always appreciate it when they have those unisex bathrooms. So
Or the
that
family
is,
ones.
or the family ones, and then that's never an issue. Because nobody
Right,
should
whoever's
feel
gonna use them,
uncomfortable
right.
no matter how they identify. They should feel like they have a place to go.
Right.
But it does, people do weird things and they can make up all kinds of reasons to get access to a place where they want to be where they shouldn't.
True. Yeah. Yeah. And how do you really police that anyway? It's like, you gotta,
Yeah.
have somebody at the door, right?
Yeah.
Most big facilities now do have like a family one or unisex.
Or they have the
Most places
symbol
the-
where it's like, hey, this is like anybody can use this bathroom. It's like,
And if there's I've been in some restaurants where it's not necessarily men and women, but they do have completely closed private stalls all in one room, and that's fine.
Yeah.
Sure.
yeah, I know in Europe a lot they've got, like the sink area is common, and then you just go into your stall, which is floor to ceiling.
Yeah. Privacy.
There's no little cracks, like who was it saying like Americans were like, we're the most we value privacy, but then our bathrooms say otherwise, right? Because we got little cracks and it's like not a lot. There's like these.
You can always see the feet.
Yeah.
You can see the feet, and there's
The
no
doors aren't
no
so
I
There's not a lot
remember
of separation.
one time, I can't remember where we were, and my oldest daughter was maybe like 4, but I was in one of the stalls and she was peeking through each crack saying, "Mommy, is that you? Mommy, is that you?" Like trying to find me. And I was just like, "Sorry, neighbors."
You see a little eyeball, Hello.
So
I'm not
true.
your mommy.
Those cracks can be pretty revealing.
Right. Sometimes they're wider than others, right? It's like,
Yeah.
how do you put these things together? Yeah. So anyway, that's kind of what's going on in the news.
Okay, well, we haven't done a snap poll in a long time. Those are kind of fun.
Oh yeah,
We should do
they're
more
kind of
those.
new snap poll anyway. But I'll hit you up with harder questions next time.
Oh,
Okay.
okay. Now that I've
You guys passed that
experienced
one.
it,
Good job.
Okay.
All right. Well, let's jump into the interview with Angela and Ruchika. Okay, everyone, we are sitting down with Angela Huston and Ruchika Shiva, who is joining us. Well, they're both joining us from across the waters. We have Ruchika in Delhi and Angela in Italy. Thank you both for taking the time to sit down with us and let us know a little bit about IRC. You both work with IRC, and we're going to get into them a little bit later. But I would love to hear from both of you just some background, where you're both from and how you found yourself involved in the sanitation and hygiene space. Ruchika, can we please start with you?
Okay. I'm from the northern part of India, so UP, Uttarakhand. So I've been working in the social development field, so mostly around community development. I did my master's in social work, so worked in urban poor and also in rural communities. And focused more on child rights and women's rights. In all that work, with respect to field travels and going different places, one of the challenges for me was with respect to access to toilets, right? You out for the whole day or you're going certain place in the field. So that was all while I worked on it, but that was a challenge personally for me, and having UTIs almost every month was a big challenge. And I think that was something that was always at the back of my mind in terms of having clean toilets to go to. While you can carry water, toilets was always a challenge. And the fact that when you work in communities, rural and urban, that this is actually a challenge for women working in both urban and rural settings, and in fact, not having safe toilets or clean toilets. The fact that in rural settings they'd have to go early in the morning or late at night, because in the day they would be visible. So, and in urban poor localities, again, there'd be issues with respect to safety and security if there's no safe sanitation or toilets close by. But in IRC, we end up talking much more just than toilets. But of course, that's our first interface, but for our personal experiences. But hopefully we'll talk more about that.
Yes.
Yeah.
Yes, for sure. So you're working with women and children in developing areas, but you personally felt the need very strongly because you had some health issues that made it a little bit more challenging for you. Is that right?
Yes.
Yeah, I think most women can relate to that, unfortunately. Yeah. Angela, what about you?
Yeah, so I have also experienced this, but in fact, I started out much more as an environmental activist. So I grew up in Minnesota, which is a place with a lot of water, but found myself all over the place after that. But I was always very passionate about the environment and protecting the environment. But I think over time, I realized that it's the way that people use the environment and depend on it, and natural resources and things like water that are actually really critical. And so I was thinking, it's great to have a natural environment, but we actually need it every day. And so my kind of environmental activism shifted to this interface of people and their needs from the environment, which brought me straight to water. And with the need for clean water comes the need to get rid of safely dirty water in our wastes, which brings you to toilets and sanitation. So that's a little bit my background. I came in from a more scientific side. So I was studying chemistry, lead toxicology. So also food is another place where humans and the environment interact and need kind of safety mechanisms. But over time, I think through spending a lot of time in rural communities all over the world, I saw that there's just this macro scale need for the basics. And that's what really got me into water and sanitation. And we go from there.
So I'm sure Darren and I both have a lot of questions, but the first one is, I want to know how often you get confused for Angelica Huston, because I'm sure that's the first thing people think when they see your name. Does that come up a lot?
It's come up. And my father is also called John, which is the director, John Huston, Angelica's father, but we have really no other connection to them.
Okay. Just checking.
Yeah, probably your Instagram gets blown up like, hey,
Yeah.
I wish.
can we be friends? You're like, who are you?
I should try to leverage that more.
Totally. So International Water and Sanitation Center, that's what IRC stands for. What's the kind of the history of that organization? It looks like you got a ton of people in that working around the world. What's maybe you could share with us the history of that organization, or is this something you guys started, or what's the history there?
Sure. So it's a funny one, being an acronym that's not used as an acronym. You've handled that very gracefully. So IRC was founded in 1968 through a partnership with the World Health Organization and the government of the Netherlands. So pre-internet days, IRC was founded to be a network, a resource hub, a reference center, if you will, for the sector. And so
like
over time,
card catalog, library, something like that, right?
Something like that, exactly. Dewey Decimal System, and to connect the different people working in this space, because even today it's quite fragmented. And so it was to bring together knowledge, best practices, and get that to where it's needed. Someone facing a challenge in one part of the world, there might be a solution that exists somewhere else. That's a little easier with the internet, but we still play that role, although IRC has over the decades evolved to do more commissioned research and now is quite mission driven. So we now work really as a think and do tank, let's say. So driving an action agenda, but still doing some of that research and still very much focused on collective action and connecting people and information.
So what are each of your respective roles and how do you work together?
I work as part of the Asia program, and we focus more on sanitation. We also focus on water and hygiene. So we're a fairly lean team here. For IRC, the focus countries are mostly in Africa, but we have a lean presence in Latin America and in Asia. So we have a program in India and in Bangladesh. And we work closely with Angela on multiple things, as in, there are a lot of things that we work on. For example, a lot of our work is with respect to not, at least in the case of Asia, is not with respect to implementation of taps or toilets or putting those on ground. It's not the case. It's more in terms of system strengthening, in terms of working with the enabling environment, working with various actors, looking at the strengths in the country and what are the weaknesses and all of that. So in IRC, we have some tools and thinking around it, and we closely work with Angela and other colleagues in the Netherlands and contextualize it. So we don't believe that you set up a tool or a thinking and it exactly needs to be the same everywhere. We often spend a lot of time discussing it and saying, how could it be best contextualized to each of the contexts, to each of the countries.
Mm-hmm. So I did have a question on that. Angela, I noticed on your bio, it said, hang on, I want to get it right, that you are experienced in dialogue facilitation across, you're working with different countries, you're working with different cultures. Can you speak to the importance of understanding what are the nuances in each of these different areas? I can imagine it would be easy to say something inadvertently that might be offensive. Toilet culture is vastly different between lots of different people. So why is that so important? And what are some of the tools you navigate in those conversations, or the tools you use to navigate those conversations?
Yeah, it's a tricky one. And you're right. I think talking to people from different countries and different cultures is already difficult. And then you want to talk about toilets. You want to talk about what happens in people's houses when no one's looking. And you want to talk about the government's role in that, right? The government is actually responsible at the end of the day for this public service. And politics is a whole nother world. So, it is challenging. And that's, I would say, what my role is quite a bit, in that I work across many of the countries that IRC is in, but I'm never going to be the expert in India. And so I have often this facilitator role, sometimes a translator role, to learn from the fact that there are very core similarities as well. What makes a toilet work? How it needs to be cleaned. It needs to be repaired sometimes. If there's a sewer, there needs to be a responsible utility or provider. I mean, there are a lot of similarities, but a sewer or a pit toilet is different in one place or another. Or a very simple example is, do you wipe with paper or do you wash with water? Mm-hmm. And that can be different from one village to the next. Mm-hmm. And so understanding that is really critical, even though some of the same tools in terms of how to understand that, how to go about transforming a challenge into a solution, how to identify who are the right stakeholders that need to be at the table to solve that problem. Those tools are very transferable, but the actual ways of going about them can be different. And so, yeah, it's a journey.
Do you have an example of where it all went horribly wrong?
I think Ruchika, we were just talking about an example of this from a technology perspective.
I'll give you one small example. So I actually have two in mind. Now I hope I remember both. So I'm going to share the one that I didn't share with Angela. So if I forget, then you can come on with that. So this was one of our partner, one of the organizations we work with was sharing that, actually when you build toilets, say in schools, and the fact that you're looking at adequate ventilation, lighting, and everything, the engineers who are they're thinking in terms of lighting, ventilation, but then they designed the doors in a way that they were, so the toilets in Asia, South Asia, are the squatting types. Mm-hmm. It's mostly in rural schools, rural houses, or institutions. So, and also in urban settings. So they designed it in a way that it was higher from below and lower from the top, and which actually doesn't work for women at all. So it was a very male-centered thinking, which didn't enable the women, or they didn't. Children didn't feel safe to use the toilets at all. So it's like working on technology without consulting people who are going to use it. Yeah, kind of can misfire. Similarly, I was talking about another religious big gathering that was there, and they had these mobile. So they looked at safe water and sanitation in a way that people would use toilets. But a lot of people now, this obviously in India, we've had the Swachh Bharat mission, and that's made a lot of difference in terms of behavior change and in terms of access to toilets and the use of toilets. So this is just at the beginning of that campaign. So I think it was, so 2014 or so, we did a sanitation assessment, and where in these large gatherings, they had these mobile toilets, and it was completely alien to the people who were coming. So they were like two women inside one cubicle, in which we actually find it so difficult to get in ourselves. So they were so dirty and they were misused. So after a certain time, they were not, people could not use it at all. So you need to keep in mind who's using it in terms of, does it make sense? Is it culturally appropriate? In certain tribal communities, you cannot look at incinerators for menstrual pads, it's seen as a bad, because they look at it differently. So it's seen as a bad thing to do. So then again, that's completely a lot of investment made in technology put, but not in use. So that bit of context plays a key role.
You guys are active, it says on your website, 8 focus countries. And Angela, I know we met in really briefly in Nigeria. Is Nigeria something you guys are I know you spoke there at the World Toilet Summit. Is that a place you're also becoming more active right now?
That's a good question. So IRC does not currently have a presence in Nigeria, but I think is interested in the context and learning more from it. I know I was quite inspired at the World Toilet Summit to see the massive political commitment and movement by the governors of the different states towards their focused vision and goal, ending open defecation. And I think from the IRC side, that our way of working is really about universality. So yes, it's critical. You can draw the boundary where you wish, but at the end of the day, this is nation states are responsible for the public service delivery and the safety of their citizens. And so Nigeria is a country that I think we feel, the population is huge. What they're achieving is huge, and the challenge is also very large. And so IRC is looking to be more active, to find some partners in Nigeria on one side, because I think we have a lot to offer from experiences in other countries there, and also to learn from the success there. I think that's really a model that could possibly be replicated or adapted in some of the other countries where we work. So things like even just a ministerial visit from, let's say, Nigeria to Ghana is something that I think can be really valuable also to stimulate ideas and find ways to go faster and further together.
Yeah, what was your biggest takeaway from the summit? I know you got to speak. Was that a surprise to you, or is that how did that come about? Did Jack Sim call you up, or how did that come about?
With no disrespect to the organizers, I learned by seeing my name in the program.
That's always fun.
But I had been working with Nicholas. Okay, so I had been
Dr. Igwe, right?
Exactly. Working with Dr. Nicholas Igwe and the organized private sector, who was helping to organize that event. So I was less working directly with Jack Sim, but more on the private sector side, which is also something inspiring about Nigeria. Having an organized private sector for water and sanitation is quite useful and exciting. And really, because of this kind of role, I think, as a facilitator and our kind of work on overall systems approaches to solving these challenges, I was asked to sort of represent IRC and really sharing back my reflections on the event and some of the things that I'd heard being talked about. So it was an exciting opportunity.
So a little impromptu speaking opportunity for you.
That's it. But, it's kind of the name of the game as a facilitator. We're always ready to go as a speaker.
Something you both have mentioned is the universality of what IRC does. And I noticed that on your website too, that we've had several guests mention one of the challenges in working in sanitation and hygiene is there are so many organizations wanting to help, but they're often siloed. And you both have mentioned kind of working across all these different organizations, both private and public, entrepreneurs, citizen groups. How do you do that? It does seem like a daunting task to take on all of these, or to bring all these different groups together. How do you manage that? Sure.
Well, I can tell you one of our brand values as IRC is being undaunted.
Okay, perfect.
Core to our identity, we remind ourselves often. But I think a simple answer is to say that there are systems in place to organize public service delivery. There is a local authority for a municipality or a district. There's a ministry for water and sanitation. Maybe it's the Ministry of Health responsible for that, or environment. But we do our best to organize behind those systems and then use our position as saying we're an international actor. We're able to knock at the doors and access all these different, whether they're NGOs or donors or financiers. And we try to use our position to leverage and get people aligned towards a shared vision, which ultimately is the owned government vision. And so in some countries, that's quite clear. We've talked about Nigeria, India, where there's a vision and a target. In others, that vision's not clear yet. And so we try to use our role to really help create that. Talk about the SDGs, talk about health, look at the numbers, look at the millions or billions of people who don't have access yet, and get people to rally behind and understand that shared vision. So the coordination might not always be 100% efficient, but we feel if we're working towards a shared vision and one that's really owned by the ones responsible for that, which in most cases really comes down to be a government authority or whoever they've entrusted to do that, we get moving in the same direction.
So if I'm understanding correctly, you guys are kind of a funnel to bring all of these different organizations and ultimately land with the people who are responsible for these big changes, the government. Is that right?
Yeah, that is. I haven't thought of the funnel image before. We've sometimes said like spider in the web or some kind of a hub. So that is the idea. It's this concept of like systems leadership, we call it. So you're leading, but not necessarily from the front. And it's a little bit about seeing that whole system and connecting people and saying, oh, what you're doing at ZuLoo, oh, that's really interesting. You should talk to these guys. And, oh, have you seen this movement? This might be really relevant for you. So there's a little bit of that. And then we, of course, add in more than connecting. We also add in some of our learning and experiences from work on the ground.
Mm-hmm. Awesome.
No, Ruchika, you want to describe how that looks?
I think one of the bits is with respect to knowledge management and capacity building, and that's also one of the things that I talk about. But I think the knowledge management bit also helps us connect all different actors. Like you mentioned, there could be NGOs, could be government, could be private sector. Obviously, in different countries, it takes different shapes. Certain places, the government's taking the lead, then obviously the way those are formed are different as compared to where probably civil society is. So yeah, it takes different shapes and forms. And like what Angela gave the example of a spider in the web, that I think is a good that would stand true for each of these contexts. One of the things that IRC is known for, because Angela mentioned that we come out of WHO, International Reference Center for Water and Sanitation. One of the things we're known for is for capacity building for rural water and sanitation, but sustainable services. And of course, we talk about urban water and sanitation too, and hygiene. So we have the Wash Systems Academy, and that's one of the platforms where we have that's also one of the ways we talk about knowledge management in terms of keeping it open, available to everyone, in terms of understanding the whole system, that you cannot be looking at one part of it in terms of just creating infrastructure or creating X kind of an infrastructure. You need to be working with the policies or influencing the policies of the government that require certain programs and hence require certain finance. The fact that you look at finance, you need to look at the capital costs, but also to keep the services going, the operation maintenance, but also when the larger bits break down in the system. So I think we connect those different aspects, and then we also do that in the different regions and in countries using the local context. So in the case of India, we work with a lot of Indian organizations in terms of taking the whole building, what we call as building blocks or the elements of the system, and how is that relevant to us? What are we strong at? What are the areas that we're not so strong at and that we need to be working as civil society with the government or with other actors on? So that's also one of the things that we do as the spider in the web.
Yeah, I like that. I like that analogy, spider in the web. I mean, it definitely takes someone to, it sounds like you guys have enough experience where you can approach any kind of country and kind of see, okay, hey, who are the policymakers, who are the actors, and be able to bring your experience to bear in those contexts and help facilitate that. Well, I was really impressed with Nigeria's, how enthusiastic they were, not just at the government level, but somebody after the World Toilet Summit was over, they were like, "Hey, do you want to go to church with us?" And we're like, "Okay, yeah, sure, we'll go to church." And then, sure enough, the minister's up there talking about the World Toilet Summit, and hey, if you see your neighbor, pooping in the bushes, you need to call them out on it. It's sort of at a grassroots level, you saw that kind of permeating through, again, not just the government, but also everybody's sort of on board with it. And how are you seeing that play out in India right now? I know the government's had a big, huge push. Is it Prime Minister Modi, right? He's very much advocating open, eliminating open defecation and rolling out toilets. How are you seeing that play out? It seems like there's a lot of momentum, but keeping that momentum going, it seems to be sometimes a challenge. What are you seeing there in India right now?
We don't see it as international experience coming into the country. Yeah, it is that, some bits of it were relevant, but often the spider in the web is about getting people together, and many a times they have solutions. So if people are talking to each other, you find the challenges, but you also find solutions. So it is facilitating those kind of discussions. So it's not necessarily getting expertise from outside, because often the expertise is in the country. So it's kind of bringing that out, talking about the challenges. It's a lack of coordination and communication often that ends up not finding the solutions and working on it. With respect to India, yes, we had the Swachh Bharat mission, huge political backing with respect to open defecation-free India. We managed to a great extent around the first phase, and now the second phase is focusing on the waste, right? The waste from these toilets, looking at solid waste in urban and rural communities. So it is actually, when you talk about the sanitation chain, so it looked at focusing on behavior change and access to toilets and the use of toilets. So actually, when you even look at the toilet bit, there is the behavior change to actually use the toilets. It's a big challenge. So I think we continue as civil society organizations to keep working on that and bringing that out, because use continues to be a challenge, and it will be. And that is it's an ongoing process. It's not going to change with one large program. But it definitely provides that momentum to bring it up and then keep reiterating that. And yes, the second phase focuses on the waste, because that actually makes it safely managed or not. So that's really key when we talk about safely managed sanitation. And it definitely, with respect to what we saw how the bureaucracy altogether, right from the top down to the village, were focused in terms of trying to make this happen. Yeah. In different places, different challenges, but that's how it is in reality, right?
Awesome. We have a few minutes left on our interview. Maybe tell us a little bit about, I was reading up on this, the Wash Systems Academy that you guys sponsor. Angela, maybe, I don't know if you want to tell us about that.
Sure. Thank you. And I appreciate you've done your research on IRC. I love that. The Wash Systems Academy, as Ruchika was talking about, is this online platform that IRC, with support and partnership from a lot of others, you're catching the way we work, has developed, which is really a platform for e-learning around all different topics of water, sanitation, and hygiene systems. There's a course on fundraising for Wash. There's a course on financing. And if you take those, you'll know the differences between funding and financing. And so this is they're quite short, straightforward courses, and they're free and available to anyone. You go to washsystemsacademy.org and you will find it. And we also collaborate with others who want to make a course or have a lot of knowledge and aren't quite sure how to structure it. So some of that, we can also create that. We do them also as e-learnings or as blended learning. So in a couple of countries, we have agreements with the National Training Institute or even with different government administrations where they say, we want all our staff to take this course, or we want all our staff to strengthen their thinking around this aspect. And it tends to all focus in on that systems. We champion the systems thinking, but of course, there's a lot of different technical topics and different courses there. So I encourage you to check it out. They're kind of fun, nice animations, little short podcasts in there as well.
Okay, awesome. Yeah, we'll definitely link to that in the show notes when we publish this episode, so people can check it out. What we have a kind of diverse audience. We're talking about, who tunes into the ZuLoo Pōōdcast. We're always surprised at, how it's a narrow space, but it's also a broad space because it covers, women's health issues or, children in school and obviously health and hygiene and obviously toilets. But what would you want our audience to know about maybe what IRC's, some of the things you have coming up? I know you have a symposium coming up next month. Maybe tell us what would you want our audience to know about what you have on the horizon?
Sure. I'll start with that. The All Systems Connect Symposium, which is in The Hague, 2nd to 4th of May this year, 2023. And this is really an event. So we've talked about this collective action approach, and we see events as really key moments to bring together people, knowledge, and also influence, create momentum in the movement towards this shared vision we have around universal services. So this All Systems Connect event does talk about what you said, Darren. We feel like it's water or sanitation or hygiene. This is all about connecting beyond that silo with health, with climate, with social justice, with financing and these kind of public financing mechanisms. So that's the event is all about bringing together different actors and thinkers from across those sectors to talk together about issues. And that's, it's a one-time event, but we do these every couple of years. We had All Systems Connect in 2019, All Systems Connect Africa last year. Now there'll be another All Systems Connect Africa, so regional focus. So we always got a lot going on. So do keep an eye out on IRC's work to be part of the movement really that we're supporting and mobilizing.
It's great to see you guys in action, and we'll definitely let people know about it. So that's awesome. We're excited to work. Are you? I guess are you going to be? The word's still out on where the World Toilet Summit's going to be this year, but or is that something you guys are typically a part of? Or I know our first time was this past year, but is that do you guys attend that often? Is that something you guys focus on?
Not every year necessarily, but we do see it as a really critical moment. And so we'll try to have someone there. I think depending on where these things are located in the world, we identify who's nearby. I was actually nearby Nigeria this time around. But at the same time, those are really key moments in terms of access as well to political leaders. Jack Sim has tons of global influence, what he's done. So we do engage both as IRC, but also we're part of the Sanitation and Water for All network, which you may have come across. So we sometimes are also representing as a member of that initiative as well.
Well, if they're going to keep springing on, spur of the moment speeches for you guys, maybe you'll be a little bit wary of coming, but hopefully not.
I'll take a platform when I've got it. We got things to talk about.
Awesome.
You got a speech in your back pocket ready to go.
Yeah.
That's great. Awesome. Well, we appreciate you guys coming on the show today. We're super excited to hopefully work with you more in the future, maybe have you on again if you don't regret it. We're super excited to work together with you.
Yeah. And we hope you can make it for the symposium. I'm sure you'll find a lot of more exciting stuff there.
Awesome. Thank you both so much. Have a wonderful night or a wonderful day, whatever fits.
Thank you so much. It's been a pleasure. I hope you can make something great of our session. I enjoyed the discussion.
Yeah, we definitely will. Yeah, thank you so much. We'll be in touch.
All right. Well, another fantastic interview. Really enjoyed speaking with Angela and Ruchika. And IRC is kind of an institution in the space at this point. They've been around a long time.
It's 1968.
Yeah, that was really cool. Based in the Netherlands, which is where they're having their big event in May. There's a lot of stuff happening in the Netherlands in May. I think we should go.
I know, right?
I know. It sounds like a nice time to go.
Yeah, we've had several guests talking about what they're going to do at this event. But yeah, I love their
hashtag on their website. Hashtag System Nerds.
Nerds.
Systems nerds. So, nerds. They're into what I like about them is they're able to go into really any country. I know they're active in mostly 8 countries, but they're looking to expand into Nigeria, other opportunities, and doing different projects. But they're able to come into really any situation and they've got the expertise and the resources to really say, hey, what's
the network.
What's needed, and using their network, their web or their funnel, whatever you want to call it. They're able to say, hey, this is what's needed, and they know immediately what to put into action, whether it's focusing on government leaders to get them on board, whether it's private industry, whether it's engineering systems. I mean, they really can see country to country what's needed, right?
Yeah.
And so they're sort of like
that's such an asset. That's great.
Yeah, that they just and they've got a ton of experts that across multiple disciplines that can really make an impact. So we're super cool. We're super excited that we got to meet them at the World Toilet Summit, even though it was briefly. We tried to track her down. We have to get you on the podcast. Yeah. Okay, yeah, we'll do it. And then
time went
away. And then what happened?
And then
we were on a plane going, I think anyway, that was kind of a whirlwind, but
it all worked out.
But anyway, but we got to meet Ruchika in India and got the time zones to work out.
You guys made a lot of connections at the World Toilet
I
Summit.
know. It was
I know. It's the place to be.
That's why I told him it was a gold mine.
Yeah.
Yeah.
Sure.
So anyway, yeah.
Great connections.
Yeah. All right. Well, thank you so much for joining us. Check out our marketplace. We got a lot of great products on there. Share this podcast with your friends. There are so many ways to get involved, bringing clean, safe sanitation to the world. And, we like to think of ourselves as a resource to connect you to places, but also, we've got our own projects that you can get involved in. So don't be shy. Say hi. We'd love to hear from you. All right, guys, have a good one.
Thank you for listening to the ZuLoo Pōōdcast. Follow us on social media at our links in the show notes below. To learn more, visit our website, ZuLoo.org. If you liked the podcast, be sure to subscribe, like, and comment. For even more ZuLoo fun, send us an email with your toilet stories to podcast@zuloo.com for a chance to be featured on the podcast. This episode of the ZuLoo Pōōdcast is sponsored by ZuLoo Inc., a benefit corporation dedicated to the goal of universal access to toilets, hygiene, clean water, and sanitation through the power of social enterprise. Learn more at zuloo.com.